Good afternoon, everyone. My name is Maya Luria with TMC for Seniors, and today we're going to be talking about something we've not been able to share this before, so I'm really excited. We're going to be talking about the effects of long COVID from symptoms to solutions. I have Emily Rich here with me. She is a Ph.D. now, along with an occupational therapist with our TMC Adult Outpatient Therapy. Welcome, Emily. How are you today?
I'm good. How are you?
Good. So, Emily, I know you have really been working a lot on long COVID as part of what you've been doing over at Adult Therapy, and I'm sure you'll be able to share with us a little bit more about that. But you do have an online audience that's watching from home, along with a small in-person audience. So I'm going to go ahead and put your slides up for you. When we're all done, if you've got any questions for Emily, please go ahead and put them in the chat, and I will ask Emily afterwards.
Sounds like a plan. All right. So yes, today we're going to be talking about long COVID. And I got into this work because I was seeing patients with similar presentations to long COVID, people who experienced conditions post-viral illnesses long before COVID existed. And so just kind of fell into my lap. So I've been talking about this since the pandemic. We anticipated that long COVID would be a thing. And it still continues to be. So thank you for being here today. We love the catchy title, From Symptoms to Solutions. I don't know that I have a solution for you to cure long COVID today. That's definitely not what I'm going to be talking about, but I will have some answers for you and hopefully some ideas in terms of improving quality of life and overall function. So let's go ahead and get started. We're going to start with a background and overview of what is long COVID, also known as LC, or lots of different things, long haulers, PACs, PASC, there's lots of terms, they all mean the same thing. We'll talk about intervention options, and we'll try a quick practice together, and then we'll have time for question and answer, both in person for those of you here and also those of you online. So again, we'll start with a background overview. Here are just a few of the many symptoms, over 200 symptoms associated with long COVID. It is an infection-associated chronic condition that occurs after infections with SARS-CoV-2, and that is COVID-19. Symptoms must be present for at least 3 months, and they can be continuous, they could be relapsing, remitting, meaning they improve and worsen in and out, or they can be progressive. Long COVID can present with just one symptom, or it can present with many symptoms. And it could also include other diagnosable conditions. And I'll talk about some of those today. It is a clinical diagnosis, as there's no biomarker currently available. It affects children and adults from a wide variety of backgrounds, races, social classes. And as I mentioned, despite the many terms that we use for it, they all mean the same thing. Long COVID is how I'll be referring to it today. A group of researchers reported in 2022 a potential increase in the risk for developing long COVID in people with a history of Epstein-Barr virus, which is common with mono, or HIV, which could be reactivated in the system. So if someone has had those conditions previously, it could be that it's reactivating those. They found more fatigue in those with a history of Epstein-Barr and more neurocognitive effects in those with HIV. Additional COVID infections and in those with existing long COVID does seem to worsen symptoms, at least for a time. So if you have COVID again after you already have long COVID, that probably will make your symptoms worse, at least for a period of time. We would expect that in most people. It doesn't mean that that worsening is going to stay that way. But it's understandable why people who have long COVID are especially cautious, hence we have a lot of people attending today online. Evidence does suggest that vaccination before getting COVID could reduce the risk of subsequent long COVID. But in people with existing long COVID, vaccination is still controversial. Some data shows changes in symptoms and others does not. Risk of developing long COVID is greater in those without vaccine than the risk with getting the vaccine. And I just want to recognize that long COVID from getting the vaccine is something that we see, and we usually are seeing the numbers are greater in those that have not had the vaccine. In other words, the potential risk of the vaccine is usually lower than the risk of getting it in the vaccine, or of acquiring the infection without having a vaccine. At present, it is believed that 7 to 8% of adults in the United States have had long COVID at some point. Some no longer have symptoms, or their symptoms are very mild, while others experience ongoing debilitating symptoms. We do see a trend that it affects more middle-aged adults than young people or older adults. But as I mentioned, it can affect anyone at any age. It's definitely more common in females. This photo, I am proud to share, was taken just a month ago, and it's on one of the buses downtown. I was going to eat brunch, and I was like, oh my goodness, you know, it's 2025, but at least we're getting some messaging out there. Our friends from the Pima County Health Department are really working to bring awareness on our buses and in other ways. While the cause of long COVID remains poorly understood, there are many potential causes, including autoimmunity. Perhaps a person's body held the potential for this, and getting COVID turned that on. And we've seen that with other conditions. The illness caused the right environment for that to happen. It could also be associated with endothelial cells, which appear to be especially affected in COVID specifically. And subsequently, there's risk for vascular injury. There could be an issue with neurological signaling. Overall, there could be neuroinflammation. Virus reactivation is a possibility affecting the immune system. And some individuals may be more genetically predisposed to developing it, and there's a lot of interest in the gut microbiome and the role there. So it could be a lot of different things and likely multiple factors at play. There's over 200 symptoms associated with long COVID. Fatigue and cognitive complaints are the most common and the most debilitating. And you'll see here the blue and the red. There was one study that showed in males, cognitive issues and abnormal breathing were more common in males, while in females, more recurring headaches, abdominal pain, and myalgias or muscle pain are more common. But again, men can have the other issues, women can have, you know, it can go both ways. Alongside long COVID, we often see these conditions present. So these could be new diagnoses. They could be worsening of existing diagnoses. And so they include things like POTS, different forms of autonomic dysfunction. Orthostatic hypotension is another form. Chronic fatigue syndrome, mast cell activation, autoimmune conditions, a huge variety of those. CTD stands for connective tissue disorders, and many more, as you can see. So these are all separate conditions that could be diagnosed and may turn on or be activated as a result of developing long COVID. One of the groups of co-occurring conditions is forms of dysautonomia or autonomic nervous system dysfunction. This visual shows how the term dysautonomia is not a diagnosis in itself, but these conditions below this umbrella of dysautonomia are what someone might be diagnosed with. And so that includes orthostatic hypotension. Yes.
You're using a lot of big words.
Okay.
I don't think people in this room, can you do a little bit of a,
Absolutely.
bring it to our level? So
yes, and I'm going to talk about what autonomic dysfunction is in just a minute. This is more just, these are the diagnoses. And I know there's like, you probably have never heard of these. So I will break these down. Some folks may have heard of them. So just if it rings a bell, great. If not, you can always reference it later. But yes, I will absolutely get into the details of these. So the autonomic dysfunction, which is just what dysautonomia means, the autonomic nervous system controls our automatic body functions. These are things our body should ideally do on its own automatically. So breathing, digestion, heart rate, temperature regulation, secretion of tears from your eyes, pupillary control, being able to dilate and constrict your eyes. So when I go out into the sun, bright sun, my pupils are going to get smaller. When I go into a dark space, my pupils are going to get larger. So this could be why some people experience a lot of light sensitivity. It could be their pupils aren't reacting as effectively as they should be. Salivation may be affected. Blood flow and circulation is controlled by the autonomic nervous system, and bowel and bladder function. Two forms of autonomic dysfunction that we may see more commonly. One is orthostatic hypotension. This is common even outside of long COVID, especially in older adults. This is when your blood pressure decreases when moving from a seated position to a standing position or laying to standing. And then the second condition is POTS. That is more common in young people typically, but we are seeing in some older adults this presentation that kind of looks like POTS. So I have people that are in their 60s, 70s coming in, and they really feel like they have POTS. So it's worth noting, and it's one of the more common conditions we see in long COVID. That includes a heart rate increase. So orthostatic hypotension is all about blood pressure. POTS is all about heart rate, which increases by at least 30 beats per minute. So my heart rate might go from 90 to 120, just from sitting to standing up. Feels like I run a marathon and all I did was stand up. So that's kind of what that looks like. If you feel heart racing, tachycardia, chest pain, palpitations, that is often associated with POTS. May or may not be actually POTS, but. Another condition that we see commonly, very, very commonly in long COVID is chronic fatigue. Now there's chronic fatigue as a symptom, and then there's a condition called chronic fatigue syndrome, which we now often call myalgic encephalomyelitis. Big word, you don't need to know that word. We call it ME/CFS. And this is a persistent feeling of exhaustion. So it's different from feeling sleepy all the time. Often people describe it as being weighed down by a ton of bricks. It's hard to lift my leg up. I just feel completely wiped out. It also may feel like you feel when you have the flu, feeling flu-like. Some people even have fevers, muscle pain, those kinds of things. And this is different from just being sleep deprived. This does not resolve with lots of sleep. People might need a lot of sleep, but they still feel crummy when they wake up. So this is a neurological disease, this ME/CFS. Chronic fatigue, again, being a symptom, ME/CFS being a condition. And it affects multiple body systems characterized by what we call post-exertional malaise. I'm going to get into what that is, as well as unrefreshing sleep, cognitive issues, which are very common with long COVID in general, and maybe orthostatic intolerance. Again, that's similar to POTS. It's this idea that when I stand up, when I go from laying to standing, go to an upright position, I have these symptoms. And of note, ME/CFS is often preceded by an infection, and this has been known way before COVID. So this has existed long before COVID. This is a cool study that was done just in 2023. It showed 4 different predominant patterns or phenotypes that people fit into with long COVID. So this first type 1 is 34% of patients. That would be that blue chunk in that pie chart. Cardiac, renal, and circulation issues. Those are their dominant issues. Type 2, almost the same amount, 33% of patients. More respiratory conditions, more sleep issues, anxiety. I have patients that say, I have never been anxious in my life, and suddenly I feel so anxious. Headache, chest pain. Type 3 is going to be that green section. 23% of patients have more musculoskeletal and nervous system disorders. And then type 4, the smaller section, is more of the digestive and respiratory disorders. You could have symptoms from all 4 of these. This does not mean they're mutually exclusive, but this is just kind of what we see from this one study in terms of phenotypes, different types of patterns of patients. So what's the prognosis? Long COVID can persist for many months, could persist for years, and it may never go away. But it definitely can resolve completely, and it definitely can improve. Whether that's within a person's control, there are certain factors that are in our control and certain factors that aren't. I see patients with long COVID all the time in the clinic, and I cannot tell you when you walk in the door what your outcome or your prognosis is going to be. But I can tell you I've had many, many patients get significantly better. Maybe they're able to return to work. Maybe they aren't quite able to return to work, but they're normal, so they feel much more normal in their function in their daily life. And then I have other folks that really experience continued symptoms that they see improvement maybe, but it's just an ongoing management situation. Some factors for prognosis may be the presentation type, which I just showed you, that phenotype. Co-occurring diagnoses definitely play a role here. If you've developed myalgic encephalomyelitis, myelitis, or long chronic fatigue syndrome, your prognosis is likely going to be different than someone who doesn't have that condition. Again, different from having fatigue. You might have fatigue and you might, in 6 months, not have that level of fatigue. Treatment options. Hopefully you are able to access some treatment options. Someone in a rural community may have a lot less access to options, so their prognosis may be different than someone who, is able to get resources from someone who's knowledgeable. Lots of other things that could fall in predict prognosis. Is this new? I think I've already alluded to this, but it's not really a new concept. Yes, COVID-19 was new in 2020. But this concept of a viral illness or an infection leading to a long-term disability or a long-term presentation of symptoms is not new. We've seen this with influenza pandemics, polio. Many of you are probably familiar with post-polio syndrome. It's different. It's not exactly the same, but this concept of something that is acute or short-term turning into something more long-term. All right, so some examples of what it might look like if someone has long COVID. Social activities limit one's ability to participate the next day. So I go out to lunch with friends and maybe I want to go shopping afterwards and I feel like I'm pushing it, but I go anyway. The next day I'm not able to get out of bed. Time on the phone or the computer answering emails is limited to 30 minutes and then the person feels like they're going to crash. They have to take a nap. A morning walk that was previously 1 to 2 miles, very active people, and now someone's barely able to make it down the street. Their morning routine might feel exhausting and lead to the afternoon is spent on the couch. They feel good in the morning and then they overdo it and now they're crashing on the couch. Or even having a long drive for your medical appointment. Let's say someone goes up to Mayo Clinic or even goes from Oro Valley down to Vail or something across town and they are completely exhausted, they're wiped out. So telehealth, virtual appointments are really helpful in this population for more reasons than one. So sometimes that picture can look kind of bleak. And so now what I want to talk about is some intervention options. And then we'll have time to talk about questions. So I know this journey can be lonely, and many people with long COVID have experienced medical gaslighting, being told it's all in their head, there's nothing wrong with them. Potentially they've experienced trauma, medical trauma or otherwise, and usually there's a long road of getting to understand what their condition is. And so I want to take a moment and just say, I believe you. Your concerns are so real, and you don't have to do this alone. I myself am an allied health provider. I'm an occupational therapist. I work in rehabilitation, but there are a host of providers and just humans, not even just healthcare providers, who can be helpful and come alongside you. So I'd like to start with the autonomic nervous system and explain that just a little bit more because it is often affected. My specialty areas are especially in this system, and so I think it's important to just go through this. So this can be affected directly by the disease process or secondarily by stress, anxiety, and changes in function. When adrenaline, which is one of the hormones that readies your body for a stress response, is sent into the bloodstream, your eyes dilate or open up, So your vision can be improved. We're scanning for any possible threat, this idea of a lion chasing me, you go into that fight or flight state, and that's this left side of this picture. When this is provoked long-term, which we might picture in chronic stress, this can overwork your eyes, it can cause blurry vision, it can cause tics in your eye, this general muscle tiredness around your eyes. And when you're in this state of stress, you might find that your mouth is dry as your body sends resources elsewhere. And so you might find it difficult to swallow. The tension that you feel may be presented as you grinding your teeth or clenching your jaw, which could put even more pressure on the muscles in your mouth. And I tend to find that grinding teeth is kind of a hard thing to pick up on sometimes. So that's often when someone can come alongside you. Breathing quicker might happen when you start to maybe hyperventilate, sending extra oxygen into your bloodstream. It might make you feel dizzy or jittery. Your heart might be racing. Sometimes the heart racing is what causes this system to go into effect. Sometimes other things cause it, and then the heart races as a side effect. So overall, I think just looking at this picture, I think we can recognize that chronic stress is not necessarily a great thing for the body. It makes we need that in the short term. If I'm going to reach on a hot stove and touch it, I want to pull my hand away really quickly. I want fight or flight to activate. That's a good thing. But after that's over, I need to be able to go back and rest and digest. And oftentimes what we see is people have trouble getting back into that rest and digest system. Their system stays on high alert. And I don't mean to make this so concrete, black and white, you're in this system or you're in that. It's really this fluid flow back and forth. But oftentimes there's just more of a dominance in that fight or flight. And so there can be challenges associated with that. So on that note, there are other ways we can help to regulate the autonomic nervous system, decrease the heart rate, and decrease inflammation, while increasing digestive activity, increasing sleep, and really effective sleep, and circulation, because this controls circulation. Breath work is one strategy, as is relaxation, to activate that rest and digest response. I want to say quickly that by recommending this, I'm not in any way suggesting that this is in your head or that you are an anxious person and that's why you're having these symptoms happen. Something is causing that fight or flight response to activate either inappropriately or for longer than it really needs to. And so talking about relaxation, talking about stress management isn't suggesting that anything that you're doing is wrong. It's trying to help that nervous system to shift back over into that rest and digest state to help manage symptoms. Grounding is a concept of it might be taking your shoes off and putting your feet onto the ground, maybe going into grass, which we don't have a lot of here, but feeling the weight of your body on the earth, really trying to feel yourself connected to something. Even sitting in a chair, can I feel the weight of my bottom into the chair? Can I notice where I am in space? Whereas sometimes people feel off. They feel like they're not here in this present moment. They're out of body. They're just not really feeling like themselves. Vagus nerve toning or vagus nerve stimulation exercises have gotten a lot more interest lately. There's a book, Stanley Rosenberg has a book about all kinds of different exercises that you can do. And there's all kinds of resources that you can look into online. But humming, singing, those things stimulate your vagus nerve, which travels through your neck. And so that's stimulating that nerve that helps with that rest and digest. That's the nerve that helps with that resting reflex. Splashing cold water on your face. This is the idea of cold plunges. You've probably heard that those have become popular. It may be right for you. It may be too much for your nervous system. So don't hear this as just you need to go jump into a really cold pool. It has to be the right thing and the right time for you. Movement helps with this vagus nerve activation, that rest and digest. Salivating, thinking about sucking on a lemon, or being ready to eat food, smelling food as it's cooking, really being mindful before you eat food, that promotes salivation, which is associated with that rest and digest response. Laughing, again, activates that, and massage can be helpful. There's lots and lots of things. And then lastly on this slide is vagus nerve stimulation devices, which again are gaining popularity. There are so many things I could say about that. I think we are getting to the point where they're getting to be more affordable, but still at this place, I wouldn't say, yes, everyone should go out and buy this one device. But I will tell you that a lot of people find it very helpful, and there's a lot of different ways to do that. So that's something you might explore. All right, the concept of brain fog is something that's resonant with most people who've experienced long COVID, as well as people who have fibromyalgia and migraines and all kinds of things, right? This, again, it's not necessarily a new concept. The mechanism may be different, it may not, but it's this fogginess. And again, this is a symptom, not a condition in itself. So cognition just means thinking skills. And so my ability to think effectively, efficiently, to do higher level things like planning, organizing, problem solving, those things may be affected. I may not be able to find words as easily, those kinds of things. So difficulty with memory, concentration, word finding, fatigue, all those things. It's common in many conditions, as I mentioned, and it has been shown in some research, it may compare to aging by 10 years. It may compare to your IQ dropping 10 points. Now, this doesn't mean your IQ has actually dropped. It just means your function in that moment is similar to your IQ being 10 points lower. And in Europe, it may be the same as exceeding the drunk drive limit. So sometimes people have this feeling of being off and almost like they're drunk. Sometimes that's what people experience. The good news is this is not likely to be permanent. Like I said, it's not that your IQ is actually dropped. I often describe it to patients as it's not that your brain has gotten less smart. It's that you can't access the information. It's there. People say that word is on the tip of my tongue and I can't access it. So it's the functional ability to be able to access that information. So again, cause, not super sure, could be inflammation. It could be that stress or immune response. There's some newer research suggesting it could be a sluggish gas exchange. That's a mouthful. Sluggish gas exchange in the lungs. But regardless, it is directly related to the degree of long-term disability. I can't tell you how many patients have said, I can't go back to work because I'm embarrassed that I can't do my job like I used to. My response is often, does that really mean you can't go back to work? You know, but there's this self-perceived, I'm not able to do my job like I used to. So often it involves accommodations, you know, rethinking things. Maybe it's pursuing a different type of employment, but it's understandable. People really feel impaired by this. So in terms of treatment, we want to address what we can. If we don't know the cause, it's often really hard to address the treatment. But if you have fatigue that is impairing your function, pretty much guarantee your cognitive or your thinking skills are going to be affected. And I often describe it, if you see on the right side, there's this visual showing this hierarchy where we need basic physiological needs to be met first, right? I need food, water, I need my heart to pump effectively, I need my lungs, I need circulation, all those things. We also need to have safety. If I'm living in a state of fear or of a potential threat, I'm not worried about planning and problem solving and organizing. And so we need those things met before we can do those higher level skills. So we find ways to compensate. So not to stop using our brains completely, but to minimize the demands while the brain and body are healing, and to just limit overall overwhelm, right? If the brain and the body are overwhelmed, we're not going to do this executive functioning or higher level demands. Hopefully that makes sense, but that is how I often explain it to my patients. And again, we're going to address fatigue, we're going to address the autonomic issues, these other things, so that we can hopefully get some improvement with the cognitive or thinking skills. Okay, sleep is another thing that is affected in almost the majority of people. Common challenges might be getting to sleep. People feeling tired but wired is a common sensation. The ability to stay asleep. Sometimes people are so exhausted they crash, but then maybe they wake up 2 or 3 hours later and they're wide awake. And that to me is often associated with that fight or flight response. I'm up here all day, I can't sustain that, so I crash. But when I fell asleep, I wasn't in a rest and digest mode. I was just in I have to fall asleep because I can't keep going like this mode. And so 2 hours later, I have enough sleep. Now I'm back wide awake in that chronic stress kind of state. Sleep-wake cycles are often challenging for people. Folks are up until 2 a.m. and they're sleeping until 4 o'clock in the afternoon. Circadian rhythm is what that's called. They feel drowsy throughout the day. They're not getting restful sleep. Patients that sleep 15 hours and they're still exhausted. It's not quality sleep. And then parasomnias, sleepwalking, sleep talking, paralysis. It's really the gamut of options here for sleep. So what do we do to manage this? Number one is circadian rhythm. That's our sleep-wake cycle. So we live in a beautiful place with lots of sunshine. Thank goodness. There's a reason I live here. In the morning, within an hour, ideally a half hour of waking up, opening the blinds, getting in some direct sunlight. It can be inside on these cold 30-something degree mornings, or it can be outside, but getting natural light. And then ideally in the evening, trying to simulate the sun's rhythm in your house as well. So maybe you go for a walk or sit outside as the sun is setting. That's a great reinforcement for the brain that now I need to be able to produce some melatonin to start getting myself tired. Trying to keep some low lighting in your house, not so much that you're at risk of falling or tripping on something, but trying not to have bright lights in your house after the sun has set. Sleep hygiene, so that is a piece of the circadian rhythm, but just that consistency. Every morning I wake up around the same time. None of the teenagers that I often see are in here where they're on the weekends, they're sleeping in until 11 or 12, and every weekday they're up at 6 o'clock, like really trying to keep that consistent Monday through Sunday. Having a really dark sleep environment with no lights, even the little light on your TV or the street light coming in from outside, which we don't have a lot of in Tucson, but those can actually really disrupt your sleep. Quiet environments, brown noise as opposed to white noise. Some people prefer that. It's a lower pitch, but that can minimize hearing a dog bark next door or an ambulance outside on the street. So you can just stay asleep, even if you're in a lighter sleep. Having a cool environment typically promotes better sleep. And then reserving your bedroom just for sleep and intimacy. So really trying to minimize working, trying to minimize staying in bed, which a lot of long COVID patients feel like they have no other option, but trying to get to the couch or trying to get to another room rather than your room that you're sleeping in overnight. Mental and emotional state, recognizing in the evening, is my mind racing? Do I feel tired but wired? Am I noticing that I've had bad sleep? And now I'm starting to have anxiety about sleep, understandably, because I can't fall asleep every night. Noticing those patterns and then trying to get help with it. This is not something that you are supposed to just fix on your own, but just tuning into those things. Fatigue and sleep have strong bi-directional relationship, meaning if my fatigue is bad, my sleep is worse. And if my sleep is worse, my fatigue is worse. Okay, so recognizing the interplay there. and strong association with mood and mental health changes. So recognizing if I do have anxiety, if I do have depression, if I am noticing changes in my mental health, that is significantly correlated to changes in sleep. And then one resource I just listed on here is CBTI. It's an app, Cognitive Behavioral Therapy for Insomnia. So that's something you can get on your phone. It's free, and it has all kinds of tools and resources on it. It doesn't have ads. It's paid for by, I don't remember right this moment, but it's a good app that's funded by the government associations or the VA or somebody. And so it doesn't have lots of ads and things. It's just a really helpful app. You can also see someone like an occupational therapist, which is what I do, or a sleep specialist. Now there's sleep where they assess your sleep, they do a sleep study. That's different than someone who does like sleep coaching or cognitive behavioral therapy for insomnia. So that's more of a therapy where you're helping to improve your sleep. Mental health, I've mentioned, you didn't cause this. This is not because you're anxious or because you're depressed, but we just see higher rates of depression, anxiety, and all kinds of things with long COVID. Whether it's because of the autonomic nervous system, whether it's because of this decrease in function, I can't get out of bed, I'm exhausted, I've lost my job. Understandably, there's going to be mental health effects from that. But depression was the only factor that predicted long-term fatigue. And so that is of note, I think, in terms of fatigue and mental health. Depression after infection is associated with, again, persistent fatigue, independent of how bad your COVID symptoms were at the beginning. So if you had a very mild case, but your depression is really significant, that can result in really significant fatigue. And then some other things that might affect these outcomes could be a psychiatric history, adverse childhood experiences. So someone who had, that's things like abuse as a child, a parent who was an alcoholic, just any kind of trauma history, divorce, multiple of those things. We know that adverse childhood experiences have a direct effect on long-term health outcomes. And yes, okay. In terms of management, obviously there's counseling. We've all heard of that when it comes to mental health. But then there's also therapy and support in terms of managing symptoms overall. And so that might be more of like rehabilitative therapies, being able to have someone to talk to, process the fact that, these symptoms are all new, your life has changed dramatically. Reframing things and trying to think about, I'm not able to do this thing yet, or right now, this is my current reality, but trying to minimize this feeling like things are going to be this way forever. I'm never going to be able to get back to where I was. I'm never going to be able to see my friends and do things like I used to do. So that's that reframing. And then trying to use distraction, not because you just need to distract yourself from what's happening, but because of that nervous system response. If I start to feel a lot of this doom and gloom, nothing's ever going to get better, this is horrible, my new reality, that stress response goes up and all my symptoms get worse. And so it's not avoiding, ignoring, but how can I try to kind of work through some of this stuff with support. Gratitude practices shouldn't just be thankful. It's not what I'm saying, but there's actually a lot of research on looking at things that you are grateful for in your day and in your week. Addressing your physical health, nutrition, sleep, and movement, hobbies, social and community engagement, and then of course medications. One of my favorite strategies to address some of the mental health challenges is called mindful self-compassion. And it's this process of starting with, let's give an example that I had plans to go out to lunch with my friends. I feel exhausted, and I start to say to myself, it's because I did too much yesterday. I should have known. I pushed myself too hard, or I never should have made these plans to begin with. I can't do this stuff anymore, right? We can get really hard on ourselves. And we know that if we do those things, it actually results in less likelihood that we'll be able to do it the next time. So if we criticize ourselves and we say, I should have known better, I should have planned, we're less likely to plan and to do those things next time. Instead, we can say, this is really hard right now. Like, I don't get to go to lunch with my friends because I'm exhausted, and I was really looking forward to this outing. Struggling is a part of life. So this is common humanity. Everyone goes through challenges. They might not be exactly like my challenges, but everybody has their stuff. And so we're not going to compare to other people's challenges, but we're going to recognize that this is part of life. We're not promised, easy, perfect lives. And then the last part is self-kindness. So in this moment, instead of shaming myself and saying what I should have done, can I just be kind to myself? Because this is really hard. So often it's thinking about what a friend would tell you, or what you would say to a friend that was going through something similar. It's really hard. It's the opposite of what we've been told our whole lives, for most of us, and it can be really helpful. It actually leads to more resilience, better health outcomes, and so that's something that I really, really like. A few resources, free resources on Kristen Neff's website. That's at the bottom here, self-compassion.org. Free guided practices, so audio that you can listen to. When you can't do it yourself, I'm like, okay, let's call in someone else to help me do this for myself. And then there's written practices, there's exploring self-compassion through writing, journaling, all kinds of things. So that's a great resource. They're all free. Biofeedback is another interesting tool. The easiest way for me to describe this now in 2025 is wearable technology. So biofeedback is just anything that gives you feedback about your body, feedback about your biology or your functioning. So there's lots of different forms. You've probably heard of heart rate variability, maybe. A lot of wearables, including Apple Watches and different things, offer heart rate variability. And that's an overall measure of health. So many people find these helpful with long COVID to say, today I'm at a 1 or I'm at a 2. It kind of gives you a score, and it takes multiple things into account. It should never dictate what you do. I don't ever want someone to wake up and look and it says, well, I'm a 2 today, not doing anything, even though I feel great. My watch tells me not to. That's where I see these going wrong, But more often than not, people wake up, they don't feel good. Then they look at it and they're like, yeah, okay, that's validation that I don't feel good today. I shouldn't overexert. Versus, a day when I feel pretty good. I don't care what my watch says, but it can help you to track patterns over time. There's respiratory training. And so that is something like this bottom right and the very bottom. This might be a video, actually. Yep, it is. So at the very bottom, this is something I do in clinic. It's respiratory training. And so we are working on getting breathing patterns to be more consistent. I don't really care if you plug yourself into the computer and do this, on a day-to-day basis. But my hope is that we learn together, what does your baseline look like? Is your breathing all over the place? Okay. How do we do a practice that's going to help you get back to a more consistent breathing pattern? Is it effective? If not, we'll find another one. And then you go home. You don't have the equipment. I don't want you to go buy something. And you know how to do it yourself at home so that you can get your breathing pattern more consistent. And you'll see the picture on the right here shows our breathing when we're frustrated versus our breathing when we experience appreciation for something. And so that's not to say we just need to walk around appreciating things all the time, but it's to show you what the nervous system response is when we experience different emotions. And so that's something that we play with. If you have a frustrating call with insurance on the phone, what happens to your breathing? And then how do we counteract that? Lots of different other types of biofeedback I'm not going to get into. There's muscle tension, noticing, oh, I'm clenching my jaw, I'm putting my shoulders up a lot. What does that do to my nervous system? How do I modify that? You can measure your sweat. You can measure your peripheral temperature, meaning are my hands and feet really cold? That's how mood rings work. You probably remember mood rings, right? They're not magic. It's just, what's the temperature of my fingers? If I'm colder, I'm more stressed. I'm more in that fight or flight. If I'm warmer, I'm more relaxed. And so you could literally hold a meat thermometer at home and just see. And right now, am I warmer, colder? There's stickers you can put on. People will wear them out and notice, like, oh, interesting. In this environment, my nervous system doesn't feel as safe. I feel more stressed. I feel more anxious. It can be helpful for people. There's a free app called Juva Health. It uses your phone camera. There's lots of things, but you all have these you can reference. And then just a little about fatigue. Fatigue, I love this quote, it robs us of our ability to think clearly and our motivation. Your body feels like it's powering off like a dying battery. So overall, we have primary fatigue from long COVID, which is actually from the condition itself. Shortness of breath, that's that post-exertional malaise. Cardiac-related fatigue, autonomic-related, or oxygen desaturation, where when you use a pulse oximeter and you can see your oxygen going down. And then there's secondary fatigue. Okay, well, now I'm not sleeping well because of COVID. Now I'm not having good nutrition because my swallow is affected, or my GI tract is affected. I'm having symptoms. My routine is off. All these other things may cause fatigue. So hopefully that makes sense. There's like the primary piece, and then there's all these other things that can result. I like to think of fatigue falling into different buckets. There's the physical energy. So when I go walk a mile, I'm using physical energy. There's cognitive energy. I'm using a lot of cognitive energy, trying to make this accessible and to choose the right words, right? There's emotional energy. Also using that because I'm public speaking right now, right? Or if you go into a conversation with a doctor that you're worried about, or if you have an emotional conversation with a loved one, that's emotional energy you're using. And that's true for excitement, right? Really good, positive things, as well as really challenging emotions. And then there's sensory energy. So if I'm in a really loud environment, or really bright lights, fluorescent lights, or all kinds of sensory kinds of pieces to that, a windy day, a really hot day, all those kinds of things. So we look at total energy in regard to all of these together. It's not just how much I did physically. I could stay at home and be on my couch, but I'm thinking a lot, and I have a movie blasting, it's really loud. That's still gonna exhaust me. So what do we do about it? We try to prevent fatigue from the beginning. That might be learning our triggers, right? Like I was talking about sensory stuff. Maybe bright lights are really fatiguing for you. So you decide to wear a hat or a visor. Maybe you don't do well with really extreme temperatures. So you decide to regulate your body temperature accordingly to minimize your body from feeling that. We also try to pace ourselves. We all pace ourselves every day, but people who have fatigue really have to prioritize that even more. Conserving energy as much as you can, sitting down when you need to. A lot of people find sitting in the shower is beneficial. Doesn't mean you can't stand in the shower. It just means you're saving your energy when you shower so that you can go to lunch with your friends, or so that you can cook a meal for yourself that night. And then, like I said, considering the types of energy. So really using that knowledge to your benefit to say, on every Monday, I'm not going to schedule 4 appointments back to back. I'm going to schedule 1 appointment Monday, 1 on Tuesday, 1 on Wednesday, 1 on Thursday. Because we know that if we spread things out, or if you're vacuuming your house, you're going to vacuum one room one day, another room another. Instead of just tackling the whole house with all the cleaning in one day, that's what results in more of this, like, I feel good, and then I did everything, and now I'm going to crash for 3 days. So trying to spread it out. Also restoring energy. How do we get more energy? Using rest and wake balance. So really resting when we're resting, and then being awake when we're awake. Regulating those stress levels. Appropriate movement, not just pushing yourself, it doesn't feel right, but finding the best movement practices, exercise for you. Spending time in nature, getting sunlight can be restorative. Adequate nutrition, hydration can be huge. And then I mentioned self-compassion. I think that can be really restorative. You want to be like this turtle that's slow and steady, rather than the rabbit that may go really, really fast and then get distracted and hop left and right, take longer, just Stay the course, slow and steady. Here's some more information about post-exertional malaise, really more for your reference than anything. If you feel like you might have this, it's often this delayed response. So I pushed myself, I felt fine, took a shower, and I went to the grocery store. But then the next day or 2 days later, I was totally wiped out. It's often prolonged. It might last days, weeks, or even a month. And then the symptoms are not just tired. Usually there's like some flu-like symptoms associated. There might even be swollen lymph nodes, muscle pain, just overall exhaustion, dizziness. And so that looks different than typical fatigue. And so that is someone that I would want to come see me, and we would work one-on-one really directly. It's a different plan that we would use. If you're experiencing difficulty with exercise intolerance, the best movement practice is the one that you will stick with. Finding the right practice for you. Again, more information for you here, really for you to reference. But I like to try to do exercise in recumbent or reclined positions. And so you can see some examples here. Swimming is often great, recumbent, biking, rowing, and then using this rate of perceived exertion scale. So checking yourself with breathlessness. Maybe other people don't think I'm really exerting, but I feel out of breath. I feel short of breath. So to me, this is more exertion. This is my perceived exertion. Some ideas about nutrition here. We have dietitians and nutritionists here at TMC. Lots of resources online. But again, just some kind of specifics for you to look into. And then play, or leisure and hobbies. These are often one of the first things to go, right? I don't have time for that. And just considering how this might give you energy back, how this might actually feed you. And so trying to find the right leisure hobby activities that you can do. There's some examples here on the bottom, but it's really about what you want to do and what you would enjoy. There's all kinds of research around chronic illness and using hobbies and leisure activities. And this is like the bread and butter of my work. It's not just work, it's occupations being things that are meaningful, that fill your time, that you find purpose in and find satisfaction and joy. So we may have time for practice, but I want to make sure we have time for questions. So we're going to skip this for now, but I gave you lots of ideas too in there. And then here's just some more resources. I mentioned some of these like mindfulness apps, the Cognitive Behavioral Therapy for Insomnia app, Kristen Neff's website, support groups that are online mostly. We are here for you at TMC Outpatient Therapy. We usually have a bit of a wait list. I'm not here to recruit patients. And we're here for you. So if you need an appointment and you feel like it would be helpful to come see a physical therapist, an occupational therapist, a speech therapist, or an audiologist, we have all those. And then my Instagram, if anyone's on Instagram, I provide a lot of free resources for long COVID and associated conditions. So I'd love to take questions both from our virtual.
So thank you so much, Emily. So I do have some questions that came in, and you can maybe, once we're all done and you take questions from the in-person audience, you can practice with them as well when we get off online. One of them was about smoking. Does that make you more likely to, are you more affected? Would you get long COVID if you were a smoker?
I don't know the research on that. My gut tells me yes, just because of the respiratory issues that we see and inflammation and those kinds of things, but I can't quote the literature on that, so I don't know for sure.
No problem. Can you be diagnosed with long COVID if you haven't actually tested positive for COVID recently?
That's a great question. As of now, I don't know what the ruling is. I know in the past they required it, but I think it just depends on your doctor. It depends on the person diagnosing. At this point, a lot of people say we can assume that everyone has had COVID, whether they tested positive or not. So I think most providers would likely be able to diagnose it, but it's hard. There's other viral illnesses that could cause these kinds of symptoms. So
when you have you seen through your research at all that if you have a certain genetic makeup, does that make you more susceptible to long COVID, down the road? I don't know if there's been enough research on that yet or not.
Yes, yeah. There's no biomarkers that are currently available, but there definitely does seem to be some of those phenotypes that may be more genetically vulnerable to developing. Yeah.
Right. Okay. So more of a connection. And if you suspect that you might have long COVID, how do you bring that up or share that with your primary care physician? How do you get them on board to really start to figure out what's wrong?
Yeah. I really hope that the majority of primary care providers are much more open now to that as a real thing. I think in 2020 and 2021, it was really hard to make the case for it. But I would probably bring in something like from the CDC or from a reputable organization that is like a printout, or just pull up the website or something and, just, I have these symptoms. What do you think? Try and engage in a conversation with your primary care, and hopefully they'll send you to a specialist, send you to a rehab provider like us here, or, you could ask for those referrals. Typically, primary care doesn't have a lot that they can offer in terms of resources, I would say, or specific treatment, but hopefully they can get those referrals to other specialists.
And when you're working with somebody, if somebody is referred to you for long COVID, what does that normally look like? Because I saw, there are so many different symptoms that you could have, which is pretty amazing, right? So just take us through quickly, what does that look like when you first meet with somebody? How do you come up with that plan?
Yeah, absolutely. So in occupational therapy specifically, which is what I'm going to speak to, someone comes in, they have a diagnosis of long COVID, or they don't. Often they don't. They're just really exhausted and they tell me I had COVID and this got worse a few months after or something. So what I do is start to learn about their day-to-day life. What's going on in terms of their function? That's what I care about as an OT. So they start to tell me, I can do things, but it's really exhausting. Or I can't do all these things on the same day. I have like so many less usable hours in the day is the phrase that we often use. And the rest of the day I'm in bed. So then I start to gather more information on what that looks like in a 24-hour routine for them. And we create goals together. So we say, what's the most important thing for you to be working on? It's not about what I care about, it's what you care about. And so usually that's fatigue, overall energy, like management. Sleep is a common one, managing pain, if that's a challenge. Being able to manage their healthcare, like often it's learning how to advocate for yourself in situations, explain to people, understanding your condition, managing medications, like all those kinds of things. But it's different. It just depends on that person in front of me and what matters to them.
Okay. And if somebody is interested in learning more about coming to TMC outpatient therapy, I do have the phone number here. I'm going to go ahead and put that on the screen. It's 520-324-7005.
Exactly. And they would just want to get a referral from their provider. It can be primary care provider, it can be specialist, whoever. And the fax number is 520-324-6498. So you would just need a faxed referral, or you can bring it in for occupational therapy, physical therapy, or otherwise.
And is it just you that works in the long COVID area as far as over at adult outpatient therapy, or is there anybody else that is also helping in that field?
Yeah, I'm the primary person that sees long COVID. We also have 2 other occupational therapists, and either of them can definitely see it as well. They have unique expertise, and so sometimes I'll send people to them intentionally. And then the physical therapist, there's multiple of those who see long COVID. So.
Perfect. Okay. Emily, I want to thank you so much for being here. I'm going to wrap up with our online audience and turn it over to you to answer any questions that are in person. So thank you for being here today.
All right. Thank you so much, Maya.
Thanks again for being here. We look forward to seeing you next week. We've got Recognizing and Avoiding Scams on Tuesday, January 21st at 10 a.m. And that will be with the Tucson Police Department. They have a senior education volunteer that works on that program. And then on Thursday, January 23rd, we hope that you'll join us for the Art of Medication Management, Strategies for Safe and Effective Use. It will include, if you come in person, will be pharmacy consults for a med reconciliation. And that is on Thursday, January 23rd at 10 a.m. to noon. If you are interested in attending that class and would like to come in person, please give us a call at 520-324-1960. We hope to see you again next week. Thank you.